Here we are again. It's another beautiful sunny day in Massachusetts where the nature doesn't know what it wants to do. But thankfully I have the one thing that helps you get through these kind of rainy days. Tons of coffee. Yum, yum. Yum, yum. Hey, you guys want to read some Reddit stuff? So, the first one. Here we are again. People with back pain talking about stuff on our back pain. And let's talk about it. Let's see what's going on. So, I have a herniated disc that causes sciatica, and I have had nothing that helps me with the pain. I tried steroids and an epidural, but no help with pain. But it made things worse to the point where I couldn't even walk or stand on both feet and crying in pain, and nothing helps. That stinks. I have been dealing with so much pain for almost 3 years now, and it's every single day I get woken up because of pain. I can't even cough or sneeze or anything without pain. That's a dead giveaway for what could potentially be the problem, for sure, right there. It gotten so bad I can't even lay down to help with the pain, and ibuprofen and Tylenol just doesn't work. I tried everything that's an NSAID to oral steroids, and no help, and PT made everything worse pain-wise, and it made me not be able to walk after it. So please help and give me ideas for my pain. Please, I can't take it anymore. Please help. Update, I went to the ER and got prescribed some medicine to get me to my next appointment, which is soon. I'm so happy they gave me some good stuff, if you know what I'm saying. Okay, so this is something that you do see quite a bit in healthcare, for sure. Back pain is something that I think it's weird. I think people underappreciate how debilitating low back pain is. Low back pain is actually one of, if not the biggest disability that happens in the United States, at least as far as I know. I'll put the stats here. I'm sure it's very high up there. I don't know if it's still up on the top. I'm pretty sure it's still up high up. If it's very high up, if not the top one. And for somebody to have to deal with it for 3 years, I mean, you think about this. If you think about like the average amount of time that somebody is on this earth, even if you're only on here for, like, let's just say hypothetically you're like on here for 75 years. A good like the first 10 years, you're still a kid. It's like, that's just like you're just going through life. But then, the actual like part of our lives, or the majority of where we do things, is you figure, our 20s, 30s, 40s, and 50s, and then, 60s. And then after that, depending on how you lived your life before. I don't want to be too judgy or whatever, but, the core of the human experience is, it's like 30, 40 years. And if you have 10% of it just like tied up and not being able to do a single thing, that's awful. I mean, that's the quality of life of that is just absolutely terrible. And it's something that I don't think people really realize, or at least fully appreciate. So it's like, it's important to, as a doctor, I'm always trying to think of that, right? Where again, I don't necessarily always think that pain is the main be all. Okay, this has to be completely taken care of for you to be able to live or whatever. But I always like to approach it on a patient by patient basis, where if somebody comes in with this kind of stuff, depending on what's wrong, you may not be able to get them out of pain completely, especially at the beginning. Like, there's going to be some work to do. Like, after 3 years of having to deal with something like this, Rome wasn't built in a day. Whatever the problem was had probably been developing over, like, the period of, like, some amount of time. It probably wasn't just, like, one day you woke up and, okay, now I'm just in pain for 3 years. There's definitely some kind of underlying issue, for sure, that clearly hasn't been addressed. And as a chiropractor, the way I would look at that, obviously the lifestyle factors. What does this guy do for work? What does this guy or gal? I don't think it specifies, but what does this guy or gal? What does this person do for a living? What did they used to do for fun? Were they an athlete in high school? Were there any other factors in life that could have caused like something that would lead up to something like this, like a previous injury? You'd be surprised at the amount of like ankle sprains and like hip injuries that I've seen that eventually lead to like a disc problem, just because of the way people walk differently whenever you have those things, if they're never fully rehabilitated. The fact that he went to PT, or they went to PT, and it made it worse. So that right there tells me that I would be curious to know what the PT did. Now, I love PTs. Everybody seems to think there's some kind of war between chiros and PTs. I think that any good chiro or PT appreciates the other one, while also keeping kind of raising their hands and being like, I'm just gonna let you do what you want to do, or what you got to do. I'm not gonna like step on anybody's toes. That's always my first rule of working with other healthcare professionals, is that you have to trust them. And I think there's a lot of trust in these kinds of situations, because I think most medical people want to do what's best for the patient. And if they see somebody who's not in their profession and they do something that maybe they don't agree with, I think they might start to maybe like overstep their bounds. I'll never do that. We have our specialties for a reason. So I would be curious to know if they went to the PT, what did the PT do? Now, if the PT, one of the cool things about PT, physical therapist, sorry, if anybody doesn't know the abbreviation. I hate it when people give me abbreviations. I don't know what it means. It drives me crazy. When you look at all of the different ways PTs can help people in the world, they can all go about it very differently. So I don't know for certain, I'm not a PT myself, so I don't know if there's like any individual philosophies inside of their profession. But if they have a PT who is more exercise based, maybe that wasn't a good call at the very beginning, because if they're in so much pain and their discs, because it sounds like a disc, I'll get that in a second. If they're doing exercises that are initiating poor movements in the lumbar spine that are causing some kind of biomechanical issue, then that's probably not something that they want to start with. They probably want to start with more passive care. So there's two kinds of care, at least in my way of viewing it. There's active care and then there's passive care. Depending on the pain levels, if somebody comes to me, it's going to be more of one or the other. Passive care is usually what we begin with people who can't do stuff, especially with like sciatica people. Sciatica is absolutely one of the most miserable things a human can go through. It's absolutely debilitating. And I don't think that people, until they fully experience it. I've had a lot of people come in here and say, oh, I have sciatica, and they describe it to me, and I'm like, I don't know. I don't think it's sciatica, man. I think you got something much more merciful, because sciatica is an absolutely debilitating thing. If you are experiencing a true sciatica, you are down for the count. It is absolutely miserable, and this does sound like a true sciatica with the whole not being able to sleep, finding no comfort in any kind of way or whatever. When you go to a healthcare professional, it's important to realize that you kind of want to pay attention to what they're doing. Not because you don't trust them, but because if you ever want to talk to whatever they did to somebody else, it'd be a good thing to know. So you figure if this person has gone to a physical therapist and they did more active care, and let's just say they weren't ready for it. And obviously I don't have all the details here. But if they went there and they did more active care when they weren't ready for it and it made them feel worse, well, now they have a bit of like let's just get like a distrust of physical therapy. And obviously if that person were to go to maybe, let's just say, a different physical therapist, they might get a different treatment plan, right? In my opinion, if somebody were to come to me like this, I would definitely start with more passive care. I would not do I playfully call the lawnmower kick, which is like a side posture. If there's a chiro out here listening to this, they know what that means. I don't think that it's a good idea to take this person and just give them the old whip whomp them. You definitely want to be more gentle with these people, which is unfortunate in a variety of ways, because these people are they've been in pain for so long, they want you to just do anything to just get them out of pain. So they're more than willing, more often than not, more than willing to let you do things that you probably shouldn't do quite as quickly, because they're kind of like they're trying to rush to the end of this misery train that they're experiencing. It is a good idea to, patient preference is obviously super important, but you have to come at it from, doctorly experience. And, you make a judgment call. Some people want you to do the big stuff really, really fast and go and just get to it. Some people can't handle that. If they're taking medication and they're still having this amount of like debilitating pain, that means that whatever's causing the inflammatory response, the injury, it's so active that the medication can't even touch it. Now, one question I will usually ask patients when they come in is, well, when you take the medication, does it take the edge off, or does it just not do anything? And that speaks to a variety of things that should be considered. If you take it and it takes the edge off, well, that means that the inflammation is not coming in so fast. It's not being created so fast that the medication is not able to suspend some of it, I guess, like to kind of soften the hit. But if you take a medication, especially a really powerful one, like if we're talking like a morphine level medication, then you know that whatever's going on is pretty, like, your body's desperate. Something's going on. Because when you think about what pain is your body recognizing that there's a problem. It's trying to heal it. But if it's not able to heal it at a rate that is faster than the damage you're doing to it, then it's going to constantly be in a state of pro-inflammatory. And of course, there are other exceptions. There are things like, inappropriate responses to pain and stuff like that. Some bodies will do that. That could be the case here. They're not necessarily like autoimmune, but there's definitely weird reactions by the body sometimes where it will inappropriately respond to pain, or it'll create inflammation that's probably bigger than, it kind of blows it out of proportion. And, some people are, and which just means that some people are a little more sensitive than others. And again, you make a judgment call, and you just kind of base what you do with them on what they can tolerate, and there's nothing wrong with that. So if this person's not able to stand, I got a little sidetrack again. I go inside these little sidetracks and I get a little doctorly. But if this person is experiencing sciatica, one of the first things I recognize is they can't cough or sneeze. That right there just sings disc. As soon as you say sneezing or coughing, I usually am immediately thinking of the disc not being either stable, or you could have a bulge, or you could have a sequester. Usually it doesn't. Sequesters don't usually respond like that. Sequestered means that part of the disc actually popped off and it's like floating around inside your spinal canal. You don't want those. Those are weird. Those are really you don't see a ton of sequesters, but when you do, they're very kind of random. Or you could actually have an honest to goodness herniated disc. Obviously we don't have the whole story here. They got the good stuff, and that really did help. That right there is they got relief, which is great. I think that's a good thing for anybody. Which I think at the end of this question, I'm actually going to talk about that because it's not quite so pertinent to this, but it's an interesting way to look at it, at least from a chiropractic standpoint, in my opinion. The whole point if this person came to me, I would say, okay, well, what did you do with the PT? If it was active, let's try a little bit more passive. Let's try some other things. A little more gentle care. But the very first thing I would do is, since I'm suspecting disc, I would do anything I could to give some traction to the low back, which means essentially just giving it space. And if there's any gentle way to do that, that would be what I would start with first. In chiropractic land, I have a flexion distraction table, which is a table where, let's just say this is the table and this is the bottom half. You put them in there and you use a little, like a lever, like a big handle, less a lever, more handle, and it will gently push the table down and bring it back up. And what that does is it lets the disc have a little bit of space so that some of the goo can go back in. But hypothetically, if it's not a disc herniation and it is just an honest to goodness, like let's just say it's like a super intense muscle spasm. Doesn't quite sound like that, but let's just say hypothetically it is. It's just a muscle spasm that just never really gets fully resolved. Then in that case, it's a gentle enough movement where it won't, at least in my experience, cause a patient to go into what I call guarding, or I guess that's what it's called. I call it guarding because I think that's just what it's called, where the body will immediately tense up because it's scared that the movement's not appropriate and that it's going to injure itself. So the muscles will get super tight, and then you'll have like a really bad spasm, and that could cause some increased pain, at least for a little while. Which could be happening when he went to the PT if the PT was doing like more active exercises, because they'll be doing a movement, let's just say a squat, right? Like a body weight squat. And when they go into the body weight squat, the disc is moving in a way that the body recognizes as potentially harmful. And it will guard the low back muscles to kind of try to keep it still. And so and then it won't feel very good because it caused some inflammation in the area. Because that's essentially what pain is. Pain is inflammation, if you boil it down to its most basic component. I feel for this person. I really, really do. I would be curious. There was no mention of chiropractic in this. I would be curious to see if a chiropractic treatment would help. If they came to me, I would definitely start on the more gentle end, and I would be really curious to know what the PT did. I'm not the person that's going to say PT is good or bad. I love PT. Well, I'll tell you PT is very good. Going to a PT instead of a chiro is fine if it's warranted. I don't think one of us is better than the other. I think that we treat similar things but different enough to make it interesting that we're two different disciplines. But there's a lot of crossover. I do a lot of like PTE, what I call PTE type stuff in my office because we do have a lot of overlap in our scopes of practice. I love giving patients exercise. I do think that going after the muscle conditioning is super important. And like I said, it's all about different philosophies. If you didn't like that PT, try a different PT because they might just treat you differently in a way that you like. And one of the smartest things I'd ever heard a teacher tell me was, there's enough pain in this world that we shouldn't be fighting. We should we should all be happy. We shouldn't be fighting over the people in pain because there's plenty of pain to go around. So we shouldn't be fighting over people like patients, like they're things that we collect because they're not. We're here to help, at least in my opinion. If you don't come to me, but you go to somebody else who knows how to help you and you find relief, then great. I'm happy. There's no negative emotions in me in that. I just want people to be happy and to get better. Really, that's all I'm after. So first comment, that honestly sounds unbearable. Yeah, truth. No, yeah, 3 years. Ugh, gross. The fact it's been going on for years makes it even worse. Glad you got something from the ER. Even temporary relief is huge. Hang in there. Okay, so actually, I guess I'll talk about it now. I think that there are conditions out there where maybe somebody can never get full relief. I had a Vietnam vet who used to come to me very early on in my career, and they were affected by Agent Orange in a way where they got, yeah, they got ankylosing spondylosis. I think I said that right. AS, we call it AS. It's a awful disease, and hopefully, potentially, I'll be able to show you a picture of it. What happens is that your body creates bone in a way that's not fully appropriate. The only way I can describe it is your body. It's not really what happens, but this is the way I like to visualize it that helps me think about it, is that your bones start to kind of melt like candle wax, and it starts to melt onto stuff that's not where it should be. And every single time and your spine essentially turns into one giant bone and it isn't able to move, but it's not very good bone. So if you move, you can physically hear your bones breaking. Ugh. Gives me the heebie-jeebies. I'm not a fan. Not a fan of it. Anyway, but he had that, and it's a condition that's not curable. Thankfully, it's not super common, but it's not necessarily super rare. It's something that people do get. Somebody comes in to me with that. Parkinson's is another good one, actually. They come to you. They will probably never not be 100% out of pain, but there are varying levels of it. And if going to the chiro or the PT or your crystal healer, whatever, whoever it is, if you swim with dolphins, I don't care what it is. If you go to them and it gives you relief, even for like an hour or two, then in my mind it's warranted, because again, pain is subjective. Pain is something that everybody deals with on some varying levels. It stinks. Nobody really wants to be in pain. You have to think that if somebody is forced in a position where they're never really able to fully escape it, some kind of temporary relief is humongously beneficial to them. Just because now they have a couple hours where they don't have to think about every single movement they do being painful. Is it sad knowing that eventually it's going to come back? Yeah. But if they do get a couple hours of relief, they can go do something that they enjoy. And whatever that is, like, okay, whatever, that's up to them. If they want to go golf, if they want to go walk their dog, they want to go play with their grandkid, that's the kind of stuff that I find super important. Being in pain sucks. Dealing with pain in a lot of ways, it kind of sucks. Having moments where you are able to experience the joys of life, I think is the most important thing with a human body. Or just humans in general. Overall, as we as humans go through this trip around the sun, however many times we get to do it, we probably experience more pain than we experience more joy. So we should really go for the joy more than the pain. I guess is my way of looking at it anyway. So yeah, I think that's really, really important, and to highlight. I do think that's super important. All right, then the next comment. I got to this point where I couldn't stand without crying, and nothing stopped the pain. I stopped eating, stopped sleeping. It was hell. I had surgery, which was necessary, but the pain didn't stop. I started walking all day, every day. I was wasting away to nothing in bed. I figured I could be in pain in bed, or I could be in pain walking and maybe keep living. That's again, that was just kind of what I was attesting to. Within a week, the pain was drastically improved. Within a few months, I felt like a normal human again. There was plenty of other small stuff I did that helped too. Don't give up. You can beat this. Yeah, and right there, I think that kind of like what I was saying with passive and active care. Actually, that's a really loaded comment in good ways. If you think about what we have to do to heal these things, active and passive care. Passive care you should definitely do at the beginning if somebody's just not able to do the things that they need to do, like if they're just ridden in bed and they cannot get up. If your muscles waste away, if it is a true biomechanical problem, if you have wasted away muscles, it's not going to make it better. Rest is important to a point, but passive care has to eventually turn into active. You can't always rely on somebody to take away your pain for you. There's obviously exceptions to that. Like don't skip dialysis, right? That one's actually kind of vital. Go to dialysis or something like that. You can't walk away that one. But if you have a biomechanical musculoskeletal type problem, sedentariness it can be beneficial on some level, but you have to move. You cannot completely stop moving. And this person says that and the comment makes it even more interesting just because of the fact that they just said that they started walking, and they said they did other stuff, but they didn't list it. But even just something as simple as walking. Walking is actually one of the best things you could do for the human body. It's really good physically. It's really good mentally. And one of my favorite, I think it was Archimedes that said it. There was a quote. We'll see if I can find it, put it on the screen. But he said that if you're in a bad mood, go for a walk. And if you're still in a bad mood, go for another walk. I think walking is the very it's like the very base level, and it's also like the peak at the very same time of the things that we should be doing that are just beneficial to us as humans. Like the amount of like research out there, it's staggering on just what the different benefits of walking are. It helps with blood sugar. It helps with all kind of crazy stuff. So walking is really, really important. I definitely think that on a if nothing else, if you don't want to go to the gym, if you don't want to do, sports or whatever to keep moving, go for a walk. Walking definitely is one of the best things you can do. Go do it. Even if you're in pain, the act of moving will usually help you feel better. And as long as you don't have like a muscle guard reaction, like I was talking about before, I think it could potentially be super, super helpful. And another thing and another important aspect of his comment was, he says in a few months he was starting to feel like a normal human again. That right there is, again, a kind of like a loaded comment, I guess, because it does take time. And if you've been dealing with a problem for 3 years, it's not going to go away in just in like one session or whatever, right? It takes time, and it stinks. Obviously, the slide into pain is not always very apparent, and it's very rare something that's not direct trauma. So like if somebody hits you with a bat or whatever, that will usually cause like an immediate reaction. Like that wasn't something that was building over like 3 months or whatever, unless you were like personally antagonizing this guy for 3 months or whatever. But that's kinetic, that's potential energy turning into kinetic energy. That's an entirely different problem. But if you do have something that you're not fully rehabilitating or taking care of, you'd be surprised at the amount of time it takes for a problem to become painful. That a lack of movement will usually do that. But yeah, something to kind of think about. Just realize movement's good. Movement is almost always good. Again, there's always exceptions. All right, another comment. The only thing that ever helped me was a nerve ablation. I have had it done starting at S4 in 3 nerves along the spine. Maybe that would help you. I hope you find relief, because waking up daily in pain for that long is exhausting and can be depressing. Good job looking for help. That is a huge thing. Nerve ablations is something that definitely a lot of people will do. What is an ablation? So an ablation is essentially, if you boil it down, it's somebody goes in there with a hot poker and burns something to the point where the tissue, I guess I'll just use the word, dies. That's kind of a rough word for it, but it goes in there. If you're having a nerve ablation, what they're doing is they're going in there, and I'm gonna make this like caveman level science, because I'm sure there's more like technical words. I'm sure people could get very pedantic about it. But if you get in there, if they go in there and they essentially burn a nerve until it dies, so that you can't feel whatever the nerve is trying to feel. Surgeons will do this for a variety. I'm pretty sure it's a surgical intervention. I think it's full blown surgical. And what that intervention will do is, if that pain is being caused by something inappropriate, let's just say a disc, whatever it happens to be, and it's compressing that nerve, if you ablate it, the hope is that you will no longer feel the pain that is being caused by the tissue being in the wrong spot. I do think it's a little double-sided. If it works, great. I think it opens up opportunities to further heal the area. I don't think an ablation in itself is very good for purely curative reasons. If let's just say it is an overreaction of the nerve to something in there, where if you just have a hyperactive nerve for whatever reason, you just genetically speaking, you have hyperactive nerves where you don't experience pain the same as everybody else. Having it ablated could be a very appropriate response. If you are not able to do PT or have any kind of procedure done in the area because the pain is so intense that you're just not able to do anything to help it get any better, I think an ablation is also very appropriate. But if you are doing it purely to mask pain, don't think it's appropriate in a lot of ways, because that the core of the issue a lot of times remains like set, and if you just have the nerve ablated, it doesn't help you cure the underlying issue that could potentially be causing it. And I think if you are going for an ablation, which again I think is fully warranted in a lot of cases. I'm not here to say that anybody's right or wrong or whatever. And again, it kind of depends on the situation. I should just put like a thing at the beginning of the video where I'm going to just say these things, but just know there's always an exception to every single thing that you say. It's just the way it is. But yeah, if somebody goes in for an ablation, I think, and it's a warranted ablation, after you have it and then after you have a recovery, I don't think recovery times for ablations are that long, at least off the top of my head. I think it's like maybe a couple weeks, if that. if you go in there and you have it ablated, you have to make sure that you are still doing things that would cure whatever the underlying cause could be. So let's just say on the simplest level, maybe it's super tight hamstrings or whatever it happens to be, or because the disc is in an inappropriate spot or whatever. You want to go in there and still do the things that you need to do to cure that. And the ablation, in my mind, allows you to go in and do things that you were not able to do to help fix the problem before the ablation. So if you're having if you have a disc problem, you still want to do your exercises where you strengthen the muscles around it so that the disc doesn't wander around where it's not supposed to. You could do your exercises that help push the goo back in your disc or whatever. But I do think that you don't want the ablation to be like the one and only thing that you do, because again, ablations are a great way of dealing with pain, but they're not all that wonderful, I guess, in a way of looking at it, for curing the thing that caused, I guess you could call it your underlying issue, the core reason for why you might have been in pain. Or it might have because you had an overactive nerve or whatever. Like I said, it kind of depends on the situation. But yeah, I think ablations are great for what they do. Anything that gives you temporary relief could be in itself like a godsend. I definitely don't think that it's bad to just chase relief in some ways, but I do think it is. I don't want to push my my values on others, but I've always thought that if you have a problem, you kind of want to go in there and understand it and try and beat it on a more like understanding level. And that's what I do with my patients or whatever. Have I recommended sometimes people go in for a surgical intervention because I feel like we can't fully take care of it? Absolutely. And I would not hesitate if I thought it was warranted, especially hips. Like if eventually there's a lot of people out there that just need a hip replacement. As much as let's just say my personal values don't like it, sometimes you just have to do it, and there's nothing wrong with that. And if it helps you get relief and it improves your life so that you could go do the things you want to do, awesome. Keep it up. And I'll support you every step along the way, quite literally, when it comes to the hips. All right, fine. Let's do one more question. Alrighty, so here's the second question. The second question is, how does this sound? But it is a post, which I'm assuming is X, I think, or Twitter, whatever you want to call it. It so says, summer camp for adults where we stay in our cabins and read all day, and then in the evenings we sit around the fire and talk about our books and eat s'mores. So, again, you can look at this and kind of just giggle because you're thinking to yourself like, oh, yeah, it's kind of like a funny comment. Yeah, that'd be great. But I think on a medical wellness level, it's probably probably not medical, but more of like a wellness type of situation. If you really boil this comment down, I think you could actually glean quite a bit of useful information out of it. So just think about this. Let's dissect. Let's pull out the scalpels and start to dissect this. So summer camp for adults where we stay in our cabins and read all day, and then in the evenings we sit around the fire, talk about our books and eat s'mores. What does this mean? To me, simple pleasures, simple joys, the things that bring us enjoyment in life don't have to be complicated. You don't have to make huge gestures. You don't have to make grandiose type of plans in your life to do these things that can bring you joy. Honestly, sometimes just sitting around and reading a book can give you the moment to just kind of like quiet your mind. I mean, if you think about what we as Americans especially, I'm sure this happens in a lot of the places in the world where people just feel like they're just doing too much. Like, their brain is just constantly like thinking about all the things you got to do. And, you just have like a constant sense of anxiety because there's just no way that you could possibly stop doing things for 1 second, to do something that you enjoy and blah, blah, blah. Because you're like, I got to take kids to soccer practice, and my mom needs me to pick her up, get a hair appointment, and my husband is this thing, and I got to make dinner when I get home. And when you are able to escape that cycle, even briefly, you get relief in a mental type of capacity. So if you were to go to a summer camp, that's why I like the idea of summer camp, because when you go to summer camp, it completely breaks the cycle, because now you're not at home. The things that you have to do, you can escape for a while. If you are forced to go to a summer camp where you lay in a cabin, and when you're in a cabin, it usually indicates that you're probably out in nature somewhere. Nature is very healing. There's the concept of grounding, which I'll probably put up a thing. I personally like grounding. Sometimes I do it where you just go outside and you put your bare foot in dirt. And and you could get some of it through shoes. I believe you get something out of it. Just kind of, even if you don't believe in the ion transfer of whatever they are trying to indicate happens with grounding, just being in nature is healing. Because if you think about what we are, humans are animals. If you really boil it down, there's there's flora and fauna. Humans are animals. We were designed to be in nature. That's how we were made. In the Wayback Machine, way back when. And I think that modern day Americans do everything they can to not be outside in a lot of ways, at least recreationally. There's I don't want to say there's a stigma to it, but there's definitely like a lack of availability. I think people just get busy, and there's nothing. And again, I'm not throwing shade at anybody, but I do think that if you can find the time to walk outside and just kind of like slow down, go to a park and just sit on a bench and do nothing and just close your eyes. If you just close your eyes and just listen to the noises around you, it is immensely helpful to the bandwidth in your brain. And I know there's a variety of other benefits, but let's just talk about it from the mental standpoint, because I think that's where they're mostly coming from with this comment. If you go outside and just listen to the birds and the bees, and you listen to kids like laughing in the background or whatever. Here in Boston, there's the Common. I think the Common is actually kind of like is kind of beautiful in a way. There's definitely been some times where I have had to drop off the girlfriend or whatever for like an appointment or whatever it happens to be. I'm in the city for some reason, and I'll bring my dog. I'll bring Chunk. I'll put a picture of Chunk right here. And we'll just like sit there like on a bench, or we'll like sit in the dirt. I've done this a couple times, or I'll just lay on my back on the grass or whatever, and you just listen to the noises around you, and I find it immensely peaceful. I really love doing it. I don't get to do it enough. I guess I gotta make another trip here soon. But when you do that, it opens up, I guess, neurons in your brain. Because if you think about it, the human brain is essentially like a computer. And when you have bandwidth is when you boil it down, the amount of stuff that your computer, or brain in this case, can do at any one point, and there's definitely a limit. The cool thing about the human brain is that you could probably increase or decrease that limit based on your lifestyle or just other things you could do to help with that kind of stuff. It's a good idea to kind of open up some of that bandwidth, because I believe there's a threshold in the brain where just dealing with certain stress is one thing, and then at some point that stress goes above that threshold, and you start to have that feeling of like, okay, I'm just doing too much. You start having anxiety. You could have like, a panic attack. And I think as we as Americans tend to do just enough stuff to sit right below the level of that panic attack, and then as soon as one thing happens, we just kind of like everything just like falls apart. I think it's a good idea to not quite be at the limit at all times, 24/7, and lower that. And I think that's an entire talk in itself. But the point of what I'm getting to is you should definitely disconnect from what you're doing on a daily basis, especially if you feel like things are just not going well. Go for a walk, as Archimedes would say. Just listen to nature. Just calm down. Just take a minute to yourself. Close your eyes. Listen to the world around you. You'd actually be amazed at what you hear. And I think it's very therapeutic. Just escaping the things that make you crazy. And, like a good example could be kids. Like you love your kids, hopefully. I hope anyway. You love your kids, but they drive you crazy. Just because they're a lot. They can be. They could definitely be a lot. And just taking a second to, just disconnect from it if you can. I know they're persistent. Just close your eyes and kind of just decompress. I think it makes a huge difference. So, yeah, there you go. Anyways, look at some comments. First one at the very top. I love it. Toss in nature hikes. Okay. Yeah, so I'm not sure if that might be a South Park reference, but again, walks. I think walks are great. You'll never hear me not say somebody to go for a walk if they're stressed out. It's simple. It's cheap. It should be free. I hope, anyway. Yeah, there you go. And then we have another comment that says, kind of dull. How about a college dorm experience where it's the first night and the world is electric and new? I don't know. I think that's kind of an interesting comment that, again, I think might be loaded with some like potential for learning. When we're younger, and I'm still pretty young, and even I've noticed that as you go through life, you will see that things they lose their luster, I guess, because everything's new, right? So like if you do something new, it has like novelty to it. One of the most intelligent things I think I've ever seen about philosophically, I guess, is the idea of like recognizing where you are in time and space, like how to extend your life. So there's the obvious like physical aspect of it where you like eat healthier and blah blah blah, and your meat suit, your body is able to last longer because you take better care of it, you have better genes or whatever, whatever it happens to be. But what about the mental aspect of it? Like when you think about where you are, like when I try to remember, like what was I doing like last week? Like what was I doing? Oh. There's a lot of things that we do on a daily basis where we don't remember it because it's not very important, right? There's no novelty to it. You drive your car to work, you drive your way back. Do you really remember every single thing that happened on your drive? Probably not, because there was no novelty to it because you've done it like 1,000 times. So they say that the more, I don't know who they is, the nebulous they, whoever they is, wherever I read it, it specifically said that your life extends the more novelty you have in your life because you are able to stop and think, and there are more like benchmarks in the timeline of your brain, so that the more novelty you have in your life, the longer your life seems because there's more things to remember, which I thought was a fascinating way to look. And a lot of it comes down to like what they call like multi-sensory learning, where it's easier to remember something if you activate more than one sense, right? So if you're like listening to a teacher talk about whatever, the Krebs cycle, something you just don't want to remember because it's just boring. It's important, but it is boring. And I don't care if you're a biochemist out there, it's boring. I'm sorry, I hate to tell you. It's just a boring thing to go over. And so if you're listening to your teacher talk about the Krebs cycle and you're like, yeah, this little step of ATP is made on this level, whatever. The one thing that you could do to help you potentially remember it a lot better is do something that activates another sense, like another sense of the human body. So you have like touch, sight, hearing, taste, smell, like it's all of them. And if you're having issues remembering things, what you could do is activate your smell. Smell is probably the easiest one to do. So get like an essential oil or whatever, one that you really like. And if you smell something while you're learning something, let's just say on your test, you put that smell back into like wherever, like maybe put it on your wrists or whatever and smell it. Your brain is much better at pulling the information out because it has multiple pathways in your brain, like connecting that information to your like to being able to remember it. So that's what they call like multisensorial learning. But yeah, anyway, so like what I'm getting to is like the novelty of when you first go to like college or whatever. Everything is brand new, so everything's exciting. Everything, your brain is like, yeah, I remember every single thing, which is why we tend to remember our childhoods so much better. Once we're like learning, you remember your school days. Like everybody, for the most part, remembers high school because there's just a ton of novelty to it in good and bad ways. Yeah, it goes to show you that as we get older, certain things just lose our novelty. And so, if you want to be happier, hopefully, have more positive novelty type experience, go on vacations, go for walk, like when you walk home or when you're going for walks with your dog, walk a different way. Don't get lost, please, but like maybe take a different road. So like let's just say you always take the main drag in your road, from where your house is. Just kind of explore, like don't peek in other, like your neighbors' windows or whatever. Please don't do that. But just like going down a different road, it creates a very simple novelty. You're going on an adventure, go on a little tiny adventures. And one, I think it makes you happier if you can just kind of let go and enjoy the process, like go with the flow, Be safe about it, obviously. Don't do anything that, puts you in potential danger. But I do think it's important to have novelty. That's what I'm getting to. I don't know if I sound like a broken record. But anyway, so that'll be enough. I think I really rambled on that first question. I probably had a ton of... I probably just talked too much. I'm sorry if you tuned it all out. But yeah, obviously Reddit still full of just tons of useful things to talk about. There you go. Hopefully you guys are enjoying your day. Hopefully the weather is better than here in Massachusetts right now, where it's like miserable and cold. Summer just doesn't want to come. 2026, the summer just refuses to come to the Northeast. It's just brutal. It's April. Doesn't want to winter just does not want to let go. But anyway, I love you guys. I think you look great today. I think you look beautiful. I'll talk to you guys soon, and yeah, we'll see you then. Keep it popping.